Tell me about your experience with orthopedic patients. What specific conditions have you worked with most frequently?
Throughout my nursing career, I have gained significant experience working with orthopedic patients, providing both preoperative and postoperative care. I have cared for patients with a wide range of conditions, including fractures, joint replacements, spinal injuries, and sports-related injuries. My role has often involved managing pain, monitoring for complications, and assisting with mobility to ensure proper recovery. Among the conditions I've worked with most frequently, joint replacements, such as total hip and knee replacements, stand out. I have developed a deep understanding of the specific needs of these patients, including wound care, managing swelling, and educating them on physical therapy exercises to regain strength and mobility. I also have experience with fracture management, particularly with patients who have undergone surgical fixation, where careful monitoring for signs of infection, proper alignment, and healing are critical. One of my key strengths in orthopedic care is patient education. I consistently ensure that my patients understand their treatment plans and how to care for themselves after discharge, whether it involves pain management, dietary adjustments, or exercises to aid recovery. Additionally, I work closely with multidisciplinary teams, such as physical therapists and orthopedic surgeons, to provide holistic care. My experience has taught me the importance of compassion and communication, particularly as orthopedic patients often face mobility challenges and emotional stress. This has strengthened my ability to provide both technical expertise and emotional support to help my patients achieve optimal outcomes.
How do you manage pain for patients with orthopedic injuries or post-operative procedures?
Managing pain for patients with orthopedic injuries or post-operative procedures requires a comprehensive, patient-centered approach. My first step is always to assess the patient's pain level and type, whether it is acute, chronic, or neuropathic, using appropriate pain scales and by observing their verbal and nonverbal cues. This assessment forms the basis of an individualized pain management plan. In terms of pharmacological interventions, I collaborate with physicians to administer prescribed medications such as opioids for acute pain, nonsteroidal anti-inflammatory drugs, NSAIDs, for inflammation, and muscle relaxants if needed. I prioritize multimodal pain management when possible, combining medications to target pain from multiple pathways while minimizing side effects. For example, I often use acetaminophen alongside an opioid for synergistic pain relief, reducing the required opioid dosage. Non-pharmacological methods also play a key role in my practice. I frequently incorporate techniques such as ice packs, elevation, and compression to reduce swelling and alleviate pain. Positioning is particularly important for post-operative patients, ensuring their comfort while promoting healing. I also encourage deep breathing exercises and relaxation techniques to help patients manage discomfort and anxiety related to their pain. Patient education is a vital aspect of pain management. I ensure that patients understand how and when to take their medications, emphasizing the importance of staying ahead of the pain rather than waiting for it to become severe. I also educate them on safe, non-invasive techniques they can use at home to manage discomfort, such as alternating heat and cold therapy or engaging in light, prescribed exercises. Communication and frequent reassessment are critical. I closely monitor patients for any changes in their pain levels, medication effectiveness, or adverse effects, adjusting the care plan as needed. By combining clinical expertise, compassion, and teamwork, I ensure that pain is managed effectively to facilitate healing and improve the patient's overall quality of life.
Describe your understanding of traction and its application in orthopedic care.
Traction is a therapeutic technique used in orthopedic care to align and stabilize fractured bones, reduce muscle spasms, and alleviate pressure on the skeletal system. It involves applying a pulling force to specific parts of the body, typically through weights, pulleys, or other devices, to maintain proper alignment during the healing process. My understanding of traction encompasses its purpose, types, and the critical nursing care involved in its application. Traction is most commonly used for fractures, such as femur or hip fractures, and for conditions requiring immobilization or realignment, such as scoliosis or spinal injuries. There are two primary types of traction: skeletal traction and skin traction. Skeletal traction involves the insertion of pins or wires into the bone, which are then connected to a weight system to apply direct force. This method is typically used for more severe fractures or long-term immobilization. In contrast, skin traction uses adhesive straps or bandages applied to the skin, with the pulling force exerted through weights. It is often used for less complex injuries or as a temporary measure before surgery. In my role as a nurse, I ensure the effective application and maintenance of traction, as well as patient safety. This includes performing frequent assessments to monitor for complications such as skin breakdown, infection at pin sites, for skeletal traction, and circulatory or neurological issues in the affected limb. For example, I am vigilant about checking for signs of impaired circulation, such as changes in skin color, temperature, or capillary refill time, and I ensure that the traction system is correctly aligned and functioning properly. Patient education is another critical component. I guide patients on the importance of maintaining proper positioning, avoiding unnecessary movements that could disrupt the traction system, and reporting any discomfort or unusual sensations. I also work to keep patients comfortable and prevent complications like pressure ulcers or deep vein thrombosis, often by incorporating repositioning techniques, providing appropriate padding, and encouraging light exercises as permitted. Traction requires close collaboration with the medical team to adjust weights and alignment as needed, and I take pride in my ability to contribute to this process with precision and care. By maintaining a thorough understanding of the principles and applications of traction, I ensure optimal outcomes for patients undergoing this vital orthopedic treatment.
What are some key considerations when caring for a patient with a cast or splint?
Caring for a patient with a cast or splint involves a combination of vigilant monitoring, patient education, and addressing comfort while preventing complications. These considerations are essential to ensure proper healing, maintain circulation, and avoid secondary issues. First and foremost, frequent assessments of the affected limb are critical, particularly in the initial hours after a cast or splint is applied. I monitor for signs of compromised circulation or neurovascular impairment, such as swelling, changes in skin color, numbness, tingling, or increased pain. Checking capillary refill, temperature, and the ability to move the fingers or toes distal to the cast is a standard part of my assessment. Any abnormalities require immediate action, as they could indicate compartment syndrome or other complications. Maintaining the integrity of the cast or splint is another key aspect of care. I ensure that the cast remains dry and intact, as moisture can weaken its structure or lead to skin irritation. For splints, I confirm that they are securely applied but not so tight as to cause discomfort or restrict blood flow. Proper positioning and elevation of the limb, particularly in the initial stages of healing, help to reduce swelling and alleviate pain. Patient education is crucial when caring for individuals with a cast or splint. I take the time to explain how to care for their immobilized limb, including the importance of keeping the cast or splint dry, avoiding inserting objects into the cast to relieve itching, and recognizing warning signs such as increased pain, swelling, foul odors, or drainage. I also provide guidance on safe mobility practices to prevent falls or injuries. Preventing complications such as pressure sores and skin irritation is another priority. I assess the edges of the cast or splint for rough spots that might rub against the skin, and I use padding to protect vulnerable areas if necessary. For patients with limited mobility, I encourage light exercises or range of motion activities for unaffected joints to promote circulation and prevent stiffness. Lastly, communication with the patient and the healthcare team is vital. I keep the team informed of any changes in the patient's condition and collaborate to adjust care plans as needed. By prioritizing these key considerations, I ensure that patients with casts or splints have the best possible support for their recovery.
How would you educate a patient undergoing a total joint replacement about post-operative care and rehabilitation?
Educating a patient undergoing a total joint replacement about post-operative care and rehabilitation is a vital part of promoting recovery and achieving the best possible outcomes. I focus on providing clear, step-by-step instructions tailored to the patient's specific needs, ensuring they feel confident and prepared for the recovery process. Before discharge, I explain the importance of pain management and how to use prescribed medications effectively, including any potential side effects to watch for. I emphasize the need to take medications as directed and provide guidance on other pain relief strategies, such as using ice packs and elevating the joint to reduce swelling. I educate the patient on wound care, teaching them how to keep the surgical site clean and dry and advising them on the signs of infection, such as redness, warmth, swelling, or unusual drainage. I also stress the importance of attending follow-up appointments to monitor healing progress and address any concerns. Rehabilitation is a critical component of recovery, so I ensure the patient understands the role of physical therapy in regaining mobility, strength, and joint function. I provide them with an overview of their therapy plan, including exercises they can perform at home, and encourage them to adhere to the program for optimal results. I also demonstrate proper techniques for activities like walking with assistive devices, such as crutches or a walker, and gradually transitioning to independent movement. Additionally, I emphasize safety precautions to prevent complications such as blood clots or dislocations. This includes maintaining proper positioning of the joint, avoiding high-impact activities during the early stages of recovery, and wearing compression stockings if prescribed. I also advise on dietary and hydration needs to support overall healing and minimize side effects from medications, such as constipation. Equally important is helping the patient make adjustments to their daily routine to accommodate their recovery. I discuss practical strategies, such as rearranging their living space to minimize fall risks, using adaptive equipment like elevated toilet seats, and enlisting support from family members or caregivers when needed. Throughout the education process, I encourage open communication, inviting the patient to ask questions or voice concerns. By providing thorough, compassionate education, I empower patients to take an active role in their recovery, helping them feel confident in managing their post-operative care and achieving long-term success after their joint replacement.
How do you assess signs and symptoms of infection in an orthopedic patient?
Assessing signs and symptoms of infection in an orthopedic patient involves a systematic and thorough evaluation of both systemic and localized indicators of infection. My approach includes regular monitoring, detailed observations, and prompt reporting of any concerning findings to ensure early intervention and prevent complications. For localized signs of infection, I carefully examine the surgical site, wound, or pin sites for any redness, warmth, or swelling, which are hallmark signs of inflammation. I also assess for unusual or excessive drainage, particularly if it is purulent or foul-smelling. The appearance of the wound edges is another critical factor. Delayed healing or wound dehiscence may signal an underlying infection. In orthopedic cases involving hardware, such as pins, screws, or joint implants, I am particularly vigilant for signs of deep infection, which may present as persistent swelling or localized tenderness. Systemic signs are equally important in detecting infection. I monitor the patient for fever, chills, or an elevated heart rate, which can indicate a systemic inflammatory response. Additionally, I evaluate laboratory values, such as an elevated white blood cell count, increased C-reactive protein, CRP, or erythrocyte sedimentation rate, ESR, as these can be indicative of infection. In cases of suspected hardware or joint infection, I am aware that specific diagnostic tools, such as synovial fluid analysis or imaging studies, may be required. For patients with fractures, external fixators, or joint replacements, I am especially mindful of more subtle or late-presenting signs of infection, such as persistent pain at the site that is disproportionate to the expected healing process. A sudden increase in pain or difficulty in mobility could indicate a deeper issue, such as osteomyelitis or prosthetic joint infection. Communication and education are integral to my practice. I ensure that patients and their families understand what signs of infection to watch for, such as increasing redness, drainage, or systemic symptoms like fever. I encourage them to report any abnormalities immediately, as early intervention is critical to successful treatment. By combining thorough physical assessments, laboratory monitoring, and patient education, I ensure that any potential infections are detected and managed promptly, reducing the risk of complications and supporting the patient's recovery.
What is your experience with wound care for orthopedic surgical sites?
My experience with wound care for orthopedic surgical sites has been extensive, and it is an area where I take great care to ensure optimal healing and infection prevention. Orthopedic surgical sites, whether from joint replacements, fracture repairs, or other procedures, require meticulous attention to detail to promote recovery and prevent complications such as infections or delayed wound healing. In my practice, I begin by performing regular assessments of the wound to monitor its progress. I carefully inspect the site for redness, swelling, warmth, drainage, or unusual odors, as these may indicate infection or delayed healing. Additionally, I assess the surrounding skin for signs of irritation or pressure from dressings. Using aseptic techniques, I perform wound care to minimize the risk of introducing pathogens. This includes properly cleaning the wound, applying prescribed antiseptics, and changing dressings with precision and consistency. I am well versed in the use of various types of dressings commonly used in orthopedic care, such as hydrocolloid, foam, or antimicrobial dressings, depending on the patient's specific needs. For instance, I have experience managing wounds with negative pressure wound therapy, NPWT, which can be particularly beneficial for larger or more complex orthopedic wounds. I ensure that these devices are functioning correctly and that the patient is comfortable with them. Pain management is another critical aspect of wound care, and I strive to make the process as comfortable as possible for patients. I also emphasize patient education, ensuring they understand how to care for their wound at home, including keeping it clean and dry, recognizing signs of infection, and avoiding activities that could stress the surgical site. Collaboration with the multidisciplinary team is essential in complex cases, such as when managing patients with comorbidities like diabetes or compromised circulation, which can affect wound healing. I work closely with surgeons, physical therapists, and wound care specialists to adapt care plans as necessary and to ensure that patients receive comprehensive support. Through consistent attention to detail, evidence-based practices, and effective communication, I ensure that orthopedic surgical wounds heal properly, minimizing complications and supporting patients in their recovery journey.
Describe a time you had to advocate for an orthopedic patient. What was the situation, and what did you do?
In my previous role as a nurse in an orthopedic unit, I had a patient who was recovering from hip replacement surgery. The patient was elderly and, while physically capable, was having difficulty understanding the importance of early mobilization post-surgery. The physician had emphasized the need for physical therapy and assisted walking to prevent complications such as blood clots and to promote healing. However, the patient seemed hesitant, expressing fear of pain and feeling uncertain about the recovery process. I recognized that the patient's concerns were not just about the physical pain but also a fear of the unknown and a lack of understanding about the benefits of the therapy. To advocate for the patient's needs, I took the time to sit down with them and explain, in simple terms, why early mobilization was crucial for their recovery. I explained the potential risks of not following through with physical therapy, such as delayed healing or complications, and reassured them that we would work together gradually. I also involved the physical therapist to address the patient's fears directly, emphasizing the supportive role the therapy team would play in their recovery. Throughout the process, I remained attentive to the patient's emotional state and made sure they felt heard, offering constant reassurance. By the end of the day, the patient was more willing to engage with the therapy plan, and over the next few days, they made significant progress in their recovery. I felt a great sense of accomplishment because I not only helped the patient understand the importance of their treatment but also ensured their emotional and physical needs were met. Through clear communication, collaboration, and empathy, I was able to advocate for the patient in a way that aligned with both their personal comfort and the standards of care.
Orthopedic patients often experience mobility limitations. How do you assist patients with ambulation and prevent falls?
When assisting orthopedic patients with ambulation and preventing falls, I focus on a combination of proactive education, proper equipment, and vigilant monitoring to ensure their safety and comfort. First, I assess the patient's mobility level, understanding the specific limitations resulting from their orthopedic condition, whether it's a fracture, joint replacement, or surgery. Based on this assessment, I work closely with the physical therapist to develop a tailored mobility plan that aligns with the patient's needs and progress. Before assisting the patient, I ensure they have appropriate footwear, as slippery or unstable shoes can increase the risk of falls. I also verify that the environment is safe and free from any obstacles or hazards, such as loose rugs or cords. I make sure the patient's bed is at a proper height for ease of transfer and that mobility aids, like walkers or crutches, are within easy reach and are the correct size for the patient. When it's time to assist the patient with ambulation, I use proper body mechanics to support them without compromising my own safety. I stand beside the patient, offering support as needed, whether through holding their arm or assisting with the walking aid. I always encourage the patient to take it slow and communicate any discomfort or instability. I monitor for signs of dizziness or fatigue, and if needed, help them return to a safe sitting or lying position. Additionally, I educate patients about the importance of pacing themselves and using their mobility aids correctly. I provide clear instructions on how to safely navigate various environments, such as walking from the bed to the bathroom or down the hall, and I reinforce the importance of asking for help if they feel unsteady. By fostering open communication, using preventative strategies, and creating a safe environment, I ensure that orthopedic patients receive the care and support they need to prevent falls while promoting their mobility.
How do you stay current with the latest advancements in orthopedic nursing care?
Staying current with the latest advancements in orthopedic nursing care is crucial for providing the best possible outcomes for my patients. I make it a priority to regularly engage in professional development activities and remain connected to the orthopedic nursing community. One of the most effective ways I do this is by attending specialized conferences and workshops related to orthopedic care, where I can learn from experts, share experiences with colleagues, and stay informed about new techniques, technologies, and treatment modalities. In addition, I subscribe to reputable orthopedic nursing journals and regularly review the latest research and clinical guidelines. This allows me to incorporate evidence-based practices into my daily care routines. I also participate in online forums, webinars, and continuing education courses, which provide updates on new surgical procedures, rehabilitation protocols, and emerging trends in patient management. Networking with orthopedic specialists, such as surgeons and physical therapists, is another important strategy for staying informed. Collaborating with them during multidisciplinary rounds or informal discussions gives me insight into the evolving standards of care and helps me understand how new innovations are being implemented in clinical settings. Lastly, I make sure to reflect on my own practice by regularly reviewing patient outcomes and seeking feedback from peers and supervisors. This helps me identify areas where I can improve and apply the latest advancements in my own work. By continuously engaging with educational resources, collaborating with my healthcare team, and reflecting on my practice, I ensure that I stay current and provide the highest level of care for my orthopedic patients.